Good evening, everyone. So generally, like when I say that, it's kind of call response. Good evening, everyone. Good evening. It's a little bit better. I want to I'm Stacy Carrillo, work in the counseling program. And I'm not going to really introduce our wonderful panel because I'm going to leave that to the individual that has really spent just a lot of time thinking about the topic and cultivating it. I've been working with Sonya Hernandez for, 8-9 months now. Yeah, and we've been talking about this. Sonya brought the topic to the counseling program, and I have to say, it was just a fabulous topic. I'm not going to go into it. I'm going to let her explain it in her incredibly articulate way. But it was just such an amazing topic. It was this idea of really bridging the social justice and community organizing and the counseling programs in a way that really is very timely and relevant. And so I just want to say it's just been a real privilege working with Sonya and seeing the good work that she is doing now and really the great work that she's going to be doing in the future. And I also want to just give a great big thanks of appreciation to all of the panelists here today because I just know everyone's really going to appreciate you sharing your expertise and experiences with us. So thank you. And so here you go.
Thank you, Stacy. I'm Sonya Hernandez, as Stacy said, and I've been working in collaboration with Stacy in the counseling department, so big thank you to them for working with me in this collaboration. Also a thank you to Zoe Hammer, because she actually helped me a lot to help with the framing of all of this. And I have to give a big thank you to Elizabeth Champney up here in the front row, because she's helped me a lot. This is a big part of my thesis project, so Liz has been there for me a lot to help me out with also framing and everything. It's been really good. Yes, I am in the social justice and community organizing department, and I see a couple of you in the audience as well. Thank you for coming, everyone. And just some info about me. When I came into this program, I really didn't know much about immigrant justice or this movement at all. And I came here right after the Freedom Education Fund win, and that was really exciting, and I learned more about it, and I was able to attend some actions in Arizona regarding immigrant rights. And then I attended the border studies class, the U.S.-Mexico border studies class with social justice and community organizing, and that really just changed my whole world. And that's when I really knew that this is what I'm doing for the foreseeable future. So my research has mainly been on sexism and gender-based violence that we encounter on the border, along with the incredible racism in U.S. laws and policies regarding the border. And of course the narratives under the current president's administration, that's a big part of it as well. But a big theme I kept seeing over and over again was trauma, how trauma is constantly in the migration process from pre-migration, migration, and post-migration. So that's where I really saw where mental health fit in, where the counseling department fit in, where there's this big intersection where we can work together on talking about these issues. So a big thing that I focus on is called collective liberation. And in short, that's the concept that all our struggles are interconnected, and that essentially we need to work together to dismantle the systems that oppress us. And so I like to think of collective liberation as kind of an umbrella, and there's different avenues that you can engage in. And so for the panel here today, I would kind of deem this as a lot of solidarity work, or we could also call it advocacy and allyship. And for those of you who don't know, is a tract in the counseling department. So it's just such a privilege to be here with these 4 awesome panelists. They all do really amazing anti-racist work. They work with the undocumented community, the immigrant rights and immigrant justice, and they're all very passionate about the physical and mental well-being of these communities. So we're going to be discussing a lot of things tonight, so we are leaving a pretty substantial amount of time at the end for questions, so please take notes and have questions in mind for the really rad panelists. And of course, the border studies class that we have at Prescott College is 3.5 weeks long, and even that isn't long enough to talk about everything that we need to know regarding these issues. So there's a lot to talk about, so feel free to come up to me or anyone else afterwards, and we can exchange contact information if you want to have further dialogue. So without further ado, I'm going to have the panelists introduce themselves, and we'll start with Fabiola.
Thank you. My name is Fabiola Agustin. I first want to acknowledge and honor the people of this land where we're at now, the Yavapai and Apache people, for their caretakers of this land. So before I start, I wanted to say that. But yeah, so my name is Fabiola Agustin. I go by the pronouns she, her, they. So I was raised in a small community by the border. It's called Somerton, Arizona. My family's roots are from the Sierra Madre in Mexico, the Virarica people. So that's where my roots and my ancestry comes from. Yeah, so I've been organizing. Well, actually, let me back up. I was raised by a Filipino farm worker, and he was a union member, and he was part of the Teamsters, not the United Farm Workers, that some people might know about. But I think that's kind of that legacy that he left, and I just really wanted to keep following that. And that's when in 2003 I became a union organizer in Tucson. And in that time there was a bill that was being proposed, Proposition 200, that was basically what it was doing. It was people working within the public sector, whether it was Department of Economic Security, where you get your public benefits, they were obligated to ask for documentation, asking people, okay, let me see your citizenship, basically needing to be play the role of Border Patrol. And so at that point is when I said, that's racist. So let's start organizing in the community, because previously I was organizing public sector workers in Tucson. So that's really where my work started in Tucson in 2003, and then. But I'm also a clinical social worker. So in the past 8 years, I've been doing a lot of mental health support for in Tucson, we have protection networks, just like there are in Phoenix, and Jason and Maria will be able to talk about that. But I supported helped start up one of the protection networks in Tucson called Corazón de Tucson. And when we started, there was a lot of things that I had noticed, a lot of issues with trauma. And so I really felt like I really wanted to, this was the area I wanted to focus on and support. And so it just happened to be that I was already part of the community, working alongside with the folks there. They're the leaders of the community, so that, they take this on very, very pridefully. And so, but at the same time, some of the work that I was doing in Tucson is not only helping individuals emotionally, but also working with organizations and groups and in developing more like a collective healing and a collective liberation process, right? So really figuring out how do we, as we continue this fight and this struggle within this movement, how do we heal and support one another? This is not a new concept. It's really all over the country and other parts of the world. So, but I will be actually doing a workshop tomorrow on the intersections of healing justice and the migrant rights movement. So yeah, please come down. Hopefully I'll see you at 9 in the morning. So, what else? Yeah, is that, I'm out of time? Okay, that's pretty much it. Thank you.
My name is Maria Kennedy. I'm a psychiatric nurse practitioner. I worked with children in my day job from the ages of 6 to 17. I'm also a volunteer at the Phoenix Allies for Community Health, which Jason and I will talk about a little bit later. Essentially, it's free psychiatric care from my perspective for the undocumented community. I'm originally from Massachusetts, and I'll say more later. Keep it short.
Hi, I'm Jason Odner. It's a privilege to be here. Thank you guys so much for having us. I am a health justice organizer and a registered nurse. I've been working at the intersection of immigrant rights and healing justice since about 2005, 2006, originally with No More Deaths. And then some of the people who are working together with No More Deaths got together and started a street medic collective called Phoenix Allies for Community Health. It's a privilege to see some street medics in the audience here today. And then later on, we moved on to form a nonprofit called Phoenix Allies for Community Health, or Clínica Patch, as our patients know us, which is a 100% volunteer-driven free clinic that grew out of the immigrant rights movement. It's an unapologetically political space where we try to carve out a space where people are comfortable and safe talking about the socio-political causes of health disparities. And so it's a privilege to be here tonight, and thank you so much for having me.
Thank you for having us. My name is Valentina Restrepo Montoya. I guess I'll grab this. I'm a mental health attorney, which might not make a lot of sense at first. Essentially, there was a case in the Ninth Circuit, the liberal circuit, the good one, Franco v. Holder. We wish they would all be like the Ninth Circuit. Franco v. Holder that held that people who are seriously mentally ill, even if they are not in criminal proceedings, even if they are in civil detention and removal proceedings, are entitled to representation. That established the National Qualified Representatives Program, and I, along with two other attorneys at the Florence Project, act as National Qualified Representatives. Before I arrived at the Florence Project, I was suing prisons in Alabama. Highly recommend it. It feels good. Inadequate medical care, inadequate mental health care, and non-compliance with the ADA. Really looking forward to talking to everyone.
Awesome. Thanks, everyone. Okay, so we're going to jump right in with our first question. It's going to be for Fabi. Let's see. So out of the many factors contributing to immigrant-related trauma, can you elaborate on what has stood out to you the most when supporting the immigrant community in your work?
Yeah, so how I was mentioning earlier about the different groups I've been working with, I think that the multi-layer, the complexity of trauma is what's really stood out. I think that there's different layers, not only from pre-migration, when starting from home, but also during the migration period, crossing the border, or so being encountering border patrol. So immediately feeling that discrimination, the harassment, whether they've been arrested and in detention. Or simply in the community. But there's also, so in living in the community, there's also this fear that they're running and extreme anxiety. So I do want to share a couple stories because it really goes with that question. Two very amazing folks that I'm working with closely actually right now. One, her name is Carolina Lopez. She is a trans woman from Acapulco, Guerrero in Mexico. She is an organizer with Mariposas Sin Fronteras. It's an organization in Tucson who works to liberate LGBTQ folks in detention center. She had just, her story is unbelievable, and so which touches on the different layers of trauma that I've talked about. But she was exposed to physical and abuse and extreme neglect at home, and by the age of 8, because she identified as a female. And her father just wouldn't accept that. And so by the age of 8, she left her home and slept on the streets, was homeless, multiple sexual assaults, gang raped. So she decided to take the journey to come to Phoenix. Actually, she didn't know where she was going to go, but she wanted to cross the border. She did at the age of 13, and she lived in Phoenix for a little while, and during that time that she was living in Phoenix, she was exposed to drugs, prostitution, and a lot of harassment from the police because of, being a brown skin. Actually, she's an Afro-Mexicana, she is, and then she's trans, so constantly harassment. And one time she lost her purse and decides, I'm gonna go ask for it. I'm gonna go to the police and see. What happened was they ended up asking for her documentation, and she was detained, and she was in Florence, and so what happened there is she was in a male detention center, so she was harassed, abused by both the other folks there, the detainees, but also majorities from the officers. The corrections officers, and thankfully she was in contact with a lawyer who wasn't from the state, was out of Boston, Massachusetts, and they put her in contact with the Florence Project. She was freed and came to live at Casa Mariposa in Tucson. She said that the best time, she was 28 by the time she was released. She said that the best time was that moment when she stepped free. But after that, she did experience a lot of depression. She had been clean for the time that she was in detention, but she had those, the relapses and still struggles with the anxiety, the depression. But what keeps her going is the community involvement and the community support. So just an amazing person. So if you ever are in Tucson, want to introduce her to you, so she'd be amazing to talk to. Also, another family that I've known from organizing with Corazón de Tucson, another immigrant network, is a family. They were involved since 2010 after SB 1070 had passed. Their daughter, most recently, the oldest daughter was started having a lot of mental crises. Although I didn't know this until the mom told me, and the daughter had been having hallucinations, audio and visual hallucinations. And one day she picks up the knife and she says, I need to end this. So she threatened that. She threatened to kill herself, but at the same time, the mom doesn't know what to do, so she calls the police. And let me know how much time I've got. Okay. And she calls the police, and so the police comes and they book her into the county jail. So again, other layers of trauma, right? So there is she is actually a DACA recipient. So she was already surviving the anxiety, and now we're talking about a psychiatric diagnosis. And in jail, it took a while before there was a psychological evaluation, and there were medications that she was getting, but just very poor treatment, because they were trying to get her they were wanting to deport her, but they really fought her attorney really fought to get her to Eloy, to the detention center, so that she would be released. So she was a total of 9 months incarcerated, and so you can imagine just someone who was very close to this family, to her family, and having these mental health breakdowns. And I was supporting the family at the time when she was incarcerated. So now she's been released, and some of the barriers that we're noticing, she doesn't qualify for any insurance, so the medications are very expensive. I'm actually trying to get her into our clinic where I work during my daytime job, to get her qualified for a SMI, which is severely mentally ill. And so at least she would qualify for the therapy and case management, and the psychiatric meds would be free. So we've been really just looking at how do we continue to support families in the different layers that they're experiencing, right? Different levels of frustration and anxiety, like I mentioned earlier, and at times, sometimes, there's always, this thought of like, I should just go back. I should just go back home. So this just giving up, wanting to give up. So family separation's a big one in terms of the different traumas, the abuse and neglect by the system. So it's state-sponsored violence, as I like to consider that, and also their individual trauma that they've experienced, like Carolina with the sexual abuse and the physical abuse. So those two stories and those two families, I feel like really stand out, especially because I'm currently working with them. But I really feel like, they're small little examples of what the current climate is and right now during this the Trump era.
Thank you, Fabi, and thank you for sharing those really powerful stories. And please make sure and thank those two individuals for letting you share those stories. Really amazing. Okay, Maria, can you elaborate on your experiences with Patch and with your one-on-one work? And please elaborate on the unique perspective that counselors have to offer to help us understand the negative social impacts of U.S. immigration policy and enforcement practice.
Sure. So I'll start with why I got involved in the Patch Clinic in the first place. So in my day job, I work with children, as I said, as a psychiatric nurse practitioner. So my role in that position was really to evaluate, like, what are the diagnostic criteria, or what are we fitting, and should they be medicated? I don't really get to do counseling in that setting, but I started knowing when I started taking the developmental history for a lot of the immigrant families that I was working with, that there was a commonality with a lot of the mothers that were coming into this country who were not documented. Something that was common was kind of as the following. So if you could think about like a woman and her husband who are coming to this country with a small child, and they make do here. They're coming without documents, without legal status, and then all of a sudden, dad's driving to the store to go pick up some groceries, and he gets pulled over. They detain him, and they deport him. Now this wife finds out she's pregnant with another child, and she's alone in this country. She doesn't have any support. In her first pregnancy, she had her family to support her, and she had her husband, but now she's alone. So she's stressed, and I don't have to tell you the effect of stress on fetal development, but it is significant. So she goes through the pregnancy, and she's strong, so she makes it through. She doesn't ask any help. She eventually gives birth and has her child, and her husband's able to come back. Maybe like 6 or 7 years later, that child is sitting in my office for a psychiatric evaluation. Oftentimes they're coming for ADHD evaluations. They're very aggressive, they're impulsive, they're upset, they're anxious. They externalize a lot of behaviors. If you look at studies are going to tell you that children who fear separation from their parents are going to have more ADHD-like symptoms than children who do not have this fear. So a lot of the time these children are getting misdiagnosed. And I will tell you, if you don't understand the political context of that, a lot of the times you might misdiagnose this, and a lot of providers will. And that's unfortunate, because then they're on stimulant medications, Ritalin and Adderall, for the rest of their lives at times. So I started thinking about, how do I help these kids? As they get older, they start presenting to me with suicide attempts, with depression. A lot of the males will present with, the teenagers will present with like homicidal ideation or severe aggression, bullying other people, and I'm expected to medicate them or to refer them for therapy. But as soon as I refer them to therapy, the therapist says, oh, no, this kid needs meds. What am I supposed to do? They're homicidal. Fix them. So I have to think about that. But I can't fix them with medication if their family structure is not intact. So if I were to think about mom's really depressed and anxious all of the time, and dad's worried about getting deported again, how am I supposed to help this child who has crippling anxiety and who doesn't want to go to school anymore because he's so worried about his family? Or he's aggressive because of this, because men oftentimes will externalize in this society. So I found the Patch Clinic, which has been a really amazing experience where I can care for adults there for free who don't have legal status. I'm able to refer my patients' parents there for psychiatric care if I see fit, because oftentimes they don't have the access to do that. So I'll share one story that I have from the Patch Clinic, which has pretty much affected me a lot. I think this was the first case I had there. So it's a 47-year-old man who was home with his wife and his 2 young children. I want to say they're elementary school age. And then the Mesa police came. They raided his house, they took his car title, they started dumping his belongings everywhere, they threw everything. He was emasculated by them, he said. And then his children were crying in the corner as the police were destroying their home. The police took his wife's purse, dumped it out. They took her life-saving heart medications and flushed them down the toilet. So he was now worried about his wife, he's worried about his children. They've arrested him and they've detained him. This previously mentally stable, healthy man develops auditory hallucinations while he's in detention. They diagnose him with schizophrenia, and they put him on a heavy-duty antipsychotic. His symptoms do not resolve. He becomes suicidal at this point. Again, it's not resolving with medication, so they keep medicating him. More medication, increase the dose. He gains about 70 pounds during that time because of the medication side effect. So he's eventually released, and he ends up for an evaluation with me, and him and his wife are saying, oh, he's got schizophrenia, can you do something? We really don't want him on this medication, though, because he gained a lot of weight, and he's lost the weight now, but he's still suicidal, and he's still having some hallucinations. So I did an evaluation, and I said, he doesn't have schizophrenia, this is trauma. It would be very normal for you to hear voices when you're experiencing PTSD, and it would be normal to have crippling anxiety after coming out of something like that, where you're worried about your wife, you're worried about your children, you've just been emasculated and you've been dehumanized to a point, and now you're released and you're expected to go on with your life as normal. So I've done some supportive therapy with him in my limited skills, because I'm not as experienced as probably the students here in counseling, but he feels better now. I gave him some Prozac, so he's able to kind of work through the suicidality and a little bit of the depression, and I've done the supportive therapy, and him and his wife are very grateful for that opportunity. So from a holistic standpoint, trauma is affecting everybody here. It's affecting the children who have to worry about their parents getting deported and separation from their families. That's going to cause suicide attempts. There's no doubt about that. It's going to cause depression, and it's going to cause anxiety. And it's something that I see on a daily basis, absolutely on a daily basis, and I can't medicate that. And that's where counseling comes in, where we need to be aware of the political climate, the trauma that they've endured. So if somebody's paranoid and they're presenting to you, and the prescriber who essentially rules for the diagnosis says, this person's schizophrenic because they're very paranoid, or they have paranoid personality disorder. We have to think about, are they paranoid because they just got deported and now they're coming back, and whenever a car drives by, they're worried, like, what if I get taken again? Is it that hypervigilance from the PTSD? So that's something to bear in mind when you have somebody who comes in your office, or if you have the kid with ADHD and they're referred to you for therapy. Dig a little bit deeper. What are they worried about? Is this like restlessness from anxiety? It's something to think about, and it's a very unique position that you are all in by informing yourselves about the political climate and understanding how to help that in a clinical level.
Thank you, Maria. All right, Jason. This is a long question, but I know you can handle it. All right. Can you tell us what you've encountered regarding the relationship between physical illness and mental illness, as well as how you've seen the conditions in Arizona, for example, Arpaio, SB 1070, ICE raids, how you've seen these things exacerbate those illnesses, and also what role you think counselors can play in these issues?
Thank you, Sonya. So when I think about our profoundly broken, stupidly broken healthcare system, right, I see most of the problems fall into four categories: commodification, compartmentalization, decontextualization, and lack of imagination, right? And it's not just broken, it's stupidly broken. Like, it is irrational, the way our system works. And so one of those, when we talk about compartmentalization, you know, our system, and y'all are aware of this, treats mental health as if it was completely unrelated to physical health, which is treated as completely separate from economic standing or political violence, right? If you want to talk to a doctor about, like, do you think maybe this is all caused by political violence? They'll look at you like you're crazy. Like, what are you talking about, man? Like, his A1C is high, it's diabetes. But it is political violence, as Maria was talking about, right? Like, the first step to treating is being able to make an accurate diagnosis. And if we don't have the courage to diagnose political violence, I know there's not an ICD-10 code for that, but we got to say it out loud, right? Because until we start saying that out loud, it's not going to get normalized. If all of us as clinicians started saying that out loud with courage and with confidence to our colleagues, to the institutions we work in, saying, well, yeah, he's got these symptoms, and it has this individual, like, I would assign this individual diagnosis, but it's clearly all caused by political violence. It's caused by structural violence, and here's why I say that. Will we get looked at like we're crazy? Hell yeah, initially. But if we all keep saying this, we can make it the norm. And until we make that diagnosis, it ain't going to get fixed. So, you know, as a nurse, like, we all know the studies on how stress hormones, chronic stress hormones affect blood sugar, blood pressure, fill in the blank. Right? Like, that's not some obscure piece of arcanic trivia. That's something that there's a million studies on, everybody knows. If you ask a physician, if you ask a nurse, is there any data on how stress hormones affect sugar? Well, I'm like, well, yeah, of course. So then you say to people, why do you think that immigrant populations and African Americans have a higher incidence of diabetes and high blood pressure? Well, it could be sedentary lifestyle. Maybe the diet sucks. It's probably they're lazy and they eat shit. It's got to be all their fault. Right? No one ever says, or it's very rare to hear someone say, well, maybe they have a higher incidence of diabetes and hypertension because of political violence, because of oppression, because of racism. When are we, as medical professionals, going to have the guts to say that out loud? Not just here at Prescott College, where I know I'm surrounded by lefties, but in the hospital, right? At our workplace. Even if we're not so sure how our boss voted, or even if we are sure how our boss voted and it ain't good, like, we got to have the guts to say that out loud. Because until we make the diagnosis, there isn't going to be the cure. There is a persistent myth in American society that anybody can get free health care in an emergency room. This is fundamentally not true. Okay? The vast majority of chronic conditions, the vast majority of what lands people in the hospital is acute exacerbations of chronic conditions. The chronic conditions will not be treated in an emergency room. And so our immigrant neighbors are locked out of access to care. So they have these multiple layers that have to be understood, right? First layer, the political and social violence and the economic oppression that comes with that. It's not just the ICE raids, although that's very real, but there's this domino effect. First, we have the very real threat of deportation, which keeps everybody scared, which is the point of it, right? The point of deportations is not to remove people from the country. The point of deportations is to keep the ones you leave behind scared. No one actually wants to remove all the immigrants. What the goal is of these policies is to keep immigrants, or at least enough of them, frightened so that they can be easily abused. Right? And then the right falls into the same thing too. Sometimes, the left falls into the same thing too. Sometimes, like, liberals, when they want to, like, they think that they're being allies, are like, oh, we should let them stay because they only take jobs Americans don't want. Wait, we should still let them stay because they're easy to oppress? Because they'll pick my lettuce? Like, that is not helpful, right? And so, but then in addition to that, because of that fear, like, when the woman is sexually harassed at work by her boss, she's going to feel more afraid to step forward, which is the whole point of these policies, right? When somebody works hard for a week as a construction contractor and then they get stiffed and not paid, or paid a tenth of what they were promised, they're going to be too scared to step up and stand up for themselves. And that doesn't always work, and certainly the immigrant communities are gutsy and fearless and highly organized. At least where I come from, I know Tucson and Phoenix, like, we have relentlessly brave, resilient immigrant populations. And they do stand up for themselves, but that doesn't mean the fear isn't there. And it doesn't mean that they're not living under that burden of fear. And then this puts them at increased risk of diabetes, of hypertension. And that leads to strokes and heart attacks and permanent disability, which means the entire family is plunged even deeper into poverty. The one kid who was born here, who's a citizen, who was a straight A student, and who was going to be the first to go to college, drops out of high school so he can get a job at McDonald's because now dad had a stroke. That shit happens. And it's time for us to call it out. It's time for us as medical professionals to start talking about how these policies are an assault on the health of our neighbors. Because people listen to us. And with that privilege comes a lot of responsibility. There's a duty for us to speak up and talk about this as structural violence. If I paid you $100, I said, here's $100, I want you to go through the barrio, find where the brown and black people live. I just wanted you to choose randomly one out of every 100 and just beat them over the head with an aluminum baseball bat. No one would have trouble seeing that as a violent thing. We would all recognize it as violence. But if we sit around a mahogany table in the centers of power and we design a healthcare infrastructure that guarantees that immigrant and African American populations will have a much higher incidence of stroke and heart attack, we don't recognize that as being a violent policy. We might see it as being unfair, unfortunate. It's too bad the guy had a stroke. But we don't see it as violence. But the stroke will land you in the neuro ICU just as quick as that other one, a baseball bat. And the fact that they have this dramatically higher risk of that stroke is not some accident of nature. It's not, no matter how lazy people's thinking is about sedentary lifestyle and diet. It is because of this structural violence that a disproportionate risk exists. And so our duty is to start talking about this, to start studying this, to start creating this dialogue, and again, not just in the safe spaces where we know we're surrounded by people of like mind. The other thing I want to say is that we got to start building the infrastructure to fight against it. And sometimes we're going to have to build it from the ground up. In 2012, a handful of us came together and we started seeing patients. And we started seeing patients under trees in a park. We saw them at their houses. We started from nothing. You don't need anything to get this going. Right now, Clinica Patch has its own beautiful little office and a beautiful atrium, and I love that we have that dignified space. But if you all think you have to wait until you have some sort of grantor to give you money to buy a dignified space, you're never going to get started. And so the system, because the system is broken, it puts these constraints on us that make it really hard to fight against the broken system, to fight against the oppression. And so, as we were talking about earlier in Sonya's thing, right? Like, it's easy to say, like, oh, well, I would love to talk about the social situation, these bigger political stressors, get to know my patient better, but the insurance company will only pay me for 30 minutes. Okay, well then, let's burn down the system, right? Let's build something different. I'm not sure, because when we say that, what we're saying is, I would love to fight against oppression if only the capitalist system would support me in that. But if we're waiting for capitalism to help us fight oppression, we're going to be waiting a long-ass time. A long-ass time. It is imperative on us to build the infrastructure that we need to be able to start fighting now. To build the infrastructure that we need to be able to spend more than that 30 minutes with our patients. To build the infrastructure where it's safe space to talk about political oppression. Where we can create these dialogues. Places that we can launch revolutions from. Places that we can support immigrant communities from and activist communities. And it is our job to build that. And in that process of building, we get to discover our direction, and discover our communities, and discover our own freedom. And so what I'll leave you with is this reflection. When you graduate and you get your license as a counselor, that license is a social contract between you and society. It is not a contract between some employer and you. It is between you and society. And it's imperative on us to reflect on, what does that mean? What are the duties that come with this right to practice? And how can I honor those duties in a way that recognizes the historical context, the political context, the economic context of the structures that are creating disproportionate burden of community health, both psychological and biological. And that's it. Thank you.
Thank you, Jason. Okay, Valentina, what are some different challenges in your line of work, and can you expand on the role of family separation and your approach to it with your clients?
So as I said, I am an attorney, myself and two others at the Florence Project. We work specifically with people who have been designated as seriously mentally ill by the Department of Homeland Security. I can see how it would seem like, well, why would the Department of Homeland Security actually designate people as mentally ill? And the answer is lawsuits. So after the opinion came down originally, they were much better about doing doing it than they are now, and so we go back with monitoring and kind of call them out for that. And what that looks like is going back and looking at medical records and seeing that someone was saying that they were hearing voices and seeing things, and that they were not identified as Franco, that they had to be placed in segregation because they were acting violently towards themselves or others, and then they weren't designated as Franco. So that's one of the battles that we're fighting. I think one of the biggest things, I have some notes here if you don't mind, I think one of the biggest things about working with people who are mentally ill, especially as a representative, is not, and I understand that what I do is very, very different from what you guys do, and I don't pretend to understand what it is that you do. I appreciate it, but I don't understand it completely. Is not reducing people to their mental illness while still taking their mental illness into account, because we are specially trained, myself not as much as you guys, but we are in our positions because we have some understanding of mental illness, we have some understanding of how that impacts people's lives and their cases and their families. And so paranoia and delusions and all of these things that we have to keep in the back of our minds, yes, this is someone who is different, this is someone who I am approaching in a different way, and I must keep this in mind all the time, but you're not just my schizophrenic client. You're not my delusional client. Delusions can be very, very hard. Trusting relationships are difficult. And I think that you have to bring your personality to the work. I think that what we do is deeply personal. Like I said, I don't totally understand your training in terms of the ethics of, I know there are a lot of ethical obligations for attorneys that are not followed by most, but the idea is that you're supposed to bring a certain amount of yourself to things in a certain way, and I think that we have to be honest about why we do the work. I think people do appreciate that. I'm a mental health attorney for immigrant detainees because my parents are immigrants and because I'm bipolar. And I tell a lot of my clients that I think it will help them. I appreciate, especially when my clients tell me that they liked an RN or an LPN because that person was open with them, or because they see that person as a person, especially in detention centers. It is so hard. People have no contact. And a lot of our mentally ill clients are in segregation. So, I mean, forget all the studies that have come out about how segregation exacerbates mental illness. They're not talking to anyone. So mental health checks and mental health rounds are really the only interaction that they're getting. And I'm not saying you have to be best friends with all your clients, but it really means something to people. Language, I'm just going to throw this out there. Language is a huge problem. I went to go see a client yesterday. I've been looking at his medical records. I love him. In his medical records, it said in all caps, making hanging gesture, yelling something we don't understand, making gesture of slitting wrists, as he was consulting. And I looked at it and I said, there's no way that they're communicating. There is no way that they are understanding each other. And I went and I asked him, I said, what's going on? Because when you and I talk, I'm understanding what you're saying. He speaks Spanish, I speak Spanish, but I'm understanding and he is, and this is, I'm going to go all over the place because there's a lot of places to go, but one of the things is, I am not a psychiatrist, but I know when my client tells me I have seen, the mental health providers here and they won't give me medication and I keep telling them that I'm hearing voices, I can't then go to the Department of Homeland Security or to ICE and say, you need to medicate my client. My client is going to kill himself. One, they don't care, and two, I don't have the space to do that. But a lot of what we do is help our clients advocate for themselves. It's really the only thing we can do in terms of their mental health treatment, and it's very, very hard to be on the outside and say there's nothing I can do about this. I mean, the most I can do is tell my client, look, you have to explain in these terms that people are going to listen, that they're going to write down what it is that you're saying, and kind of of get it. But I talked to him, and he said, yeah, no, some officer's translating for us, and he definitely doesn't speak Spanish, and so it's not getting across. And so now what am I doing? I'm pushing to get an interpreter in there, but DHS and ICE wouldn't want me to get an interpreter in there. I would like to push to get an interpreter in there. But so then what's the other avenue? Do we do a psychiatric evaluation earlier than we normally would so that we can get that diagnosis back, so that we can use that diagnosis to then go to ICE and DHS? So it's a lot of trying to weasel your way into spaces that aren't supposed to be for you because other people aren't doing their jobs. There's one thing, and this is also from the Alabama case, and in the work that we're doing now, it's so important. I am not lecturing you guys, but, you know, I mean, you guys are the hope. It's seeing just the malpractice in your field is just, I mean, and I'm coming from Alabama, so it's not you, it's them. But it makes me appreciate so much that there are hippie liberals who are going to do this work. And I really want you to know that whatever progress notes you're writing, someone's going to read them, and someone is going to stand up in court and use those progress notes either against or for my client. And that is so important. It's so important to be clear and to ask people the right questions and to keep in mind, as other people have said, all of the context of what's going on. And we do have, you know, for example, the psychiatrists that we are able to bring in to do the evaluations. They're very good at that. And so I've seen it done well. I've seen the cultural competency. I've seen, you know, other things be taken into account, because a lot of times, and this is also what's difficult about the work, we don't know where this mental illness comes from. I don't know your family's history if you are out of touch with your family and your family is somewhere in Mexico or is not somewhere in Mexico, and I don't know if you're estranged from them because, you know, they're not there because of political violence, or, you know, I mean, and then good luck getting records from Guatemala and Honduras, and it really is, you're starting from scratch. And then there are all of these gray areas of, and this comes out in the psych evals, of, well, where's this coming from? Is this person, you know, paranoid because it's a symptom of their schizophrenia, or is this person paranoid because they were chased across a country by gangs and then prosecuted in this country? And I think it's very hard to sort of parse where we're coming from, and I think we need to be really cognizant, and it takes a lot of patience. I also, and this is a specific challenge of being a qualified representative, but I think it does have a little to do with what you guys do. Autonomy is so important, and I can't even pretend to say that I know how I'm doing it, that I'm doing it right, but I hope that my clients have autonomy. And one of the most specific examples is there's something called voluntary departure, which I think is a kind of poetic term for suicide, but it really just means self-deporting yourself. And if you want voluntary departure and you're Franco, it's not up to you, it's up to your attorney. And that's something that you struggle with, is if someone who is mentally ill is telling me that they want to deport themselves, right? They're in detention. I'm not in detention. As long as their case is going on, they're staying in detention. So let's say they haven't bonded out. And their case is going to take months and months and maybe years. And they say, well, you know what? This isn't looking really good. We've gone to a couple of court dates and we've had to continue it, and it looks like the other side's really mad at me, and I don't want to stick around for this. Like, this is, the detention center is terrible. I get it. Like, not disparaging people at all. I understand I would not be able to survive a day in a detention center. But there is an element of you weighing how much of this is your mental illness, how much of this is your exhaustion, how much of this is your actual choice, and I think that that's very difficult, and I don't have the answer for that. But it is definitely a challenge. We've touched a good amount on mental health and separation and families, and ICE, so this is just a quick legal wonky thing. ICE just reversed its directive on pregnant women in custody, which is really, really a travesty. We fought very hard as the Florence Project to have ICE release women who are pregnant, because I don't know. And now ICE has changed their mind and decided that pregnant women should be detained. I don't have to. You guys know the effects of that more than I do. It's disgusting. These are not the views espoused by the Florence Project. They are the views espoused by me. I think that it is absolutely terrorism to try and scare people from coming to this country by separating them. And this is something that people are talking about, that John Kerry in 2017, I think, I'm not sure, but John Kerry, there was at one point a policy sort of snippet about separating families as a deterrent to get people to come to this country. I think that's disgusting, and I think that our administration knows exactly what it's doing when it comes to mental health and using it against people. It's a really hard balance. I think that I'll just, I guess, one more really quick thing. When we do bond hearings, so when we go in and we ask the judge, please release my client, there's a certain client that you get that is very, very exciting. A client who has never been medicated before. A client who has been ill their entire lives, who has wandered around the desert and lived in Mexico with no resources and is now in the United States, and by whatever has befallen them has wound up at the E-Lawyer Florence Detention Center, and oh my goodness, they're diagnosed and they're medicated. Are they perfectly medicated and diagnosed? Probably not, but I've seen this client, over the course of 2 or 3 months, and this is not one client, this is many clients, over the course of 1 or 2 months, and they are sleeping better, and they're speaking more clearly, and they're not talking about the video games that they're playing in their minds, and they're not talking about the chips. And suddenly, well, first of all, I'm very, very excited, but suddenly I have to go explain to a judge, look what has happened to my client is fantastic. This facility has been just wonderful. You have resurrected my client. Thank you so much. But now I need my client to get out so they can get other services. And so what would you say if you were a judge? You would say, well, this is a person who, let's look at the medical records, let's look at the disciplinaries. It sounds like he was pretty violent and wanted to kill himself a couple of months ago. Now you're telling me he's getting great treatment. Why would I release your client? And it takes a lot of educating judges, and this is another reason why the notes are so important, is that judges don't have this background. Judges just see a certain kind of detainee. They only see a certain kind of asylee. And you really have to educate judges as to mental illness. You have to educate them as to the effects of detention on mental illness. And obviously judges don't want to hear about how being in detention is exacerbating the symptoms of our clients' mental illnesses. But you also have to educate them as to, psychotherapy and group therapy and all of these things that our clients are not getting inside. I think judges just think, well, they're medicated and everything's going great, so we should probably keep them here. I think that the clinical depression, I'll just touch on mental health and hopelessness. I think that probably all immigrants are clinically depressed. I don't see how you could be treated the way that you are in this country and have to go through the things that you have to. You don't come to the U.S. just for fun, right? Everyone's got this terrible, terrible past. And then you come here and then, you have to fight for every inch of space that you want to take up or that you need to take up. And I'm not surprised at all that our communities are suffering from this. And I thank you all very, very much for your work. Thank you very much.
Thank you, Valentina. I was just thinking that out of everyone up here, your field is definitely the one I know the least about. So thank you for all those.
Good for you.
Yeah, thank you for those clarifications. It's really helpful. Before we move on to our last question for the panelists, I wanted to put Maria on the spot, actually. We talked briefly before about the peer support group that you've been working on. So I was hoping that you could just talk about that briefly and your role in it.
Sure. I think I was supposed to mention this, but I forgot.
Okay.
So oftentimes what I see in Patch is a lot of like flashbacks and nightmares, which I can take care of with medication and a little bit of supportive therapy, I hope. But a lot of what I've been encountering too, especially for the women, is isolation and loneliness. And this really contributes to depression and anxiety, and it leaves them predisposed to that. It makes sense that they come to this country and they don't really have a community support right away. And sometimes they feel like they have no one to talk to. In particular, I have one woman who told me she goes outside and just talks to the trees because she has nobody else and she's just so lonely. So she agreed to talk to me just so she'd have like a friend, but she was opposed to therapy, which I understand. So I kind of got involved with this group of people at Patch who are already developing a support group for women. She had originally intended it to be like a group therapy type thing for depression and anxiety, but we kind of had to alter the vision a little bit, so it's more of just support networking. It's going to be peer-led. That means that I don't lead it as a mental health professional. The women have the power in the community to lead their own group and to decide their vision and what they want to do. We are simply kind of coming together to offer them the resources and the support and the space to do that. And hopefully a little bit of training from my end on how do you run a group therapy session, or even a support group, or how do groups form and work. Things that you guys know a lot about already, but we're in the final stages of developing this right now. The goal being that women can end up coming together once a week or once every other week, depending on how they want to go about doing it, and just to build community and build more connections. That way we have less depression and they don't feel like they have to go outside and just sit there alone. They have someone they can get in contact with if they feel suicidal, and I think in the long run that has huge implications for our community.
Thank you. All right, so the last question for everyone before we come to the Q&A. What would you like the counseling students here to walk out of this room with tonight knowing? And we can start with Fabi. Or we can do popcorn style, if you guys prefer, whatever you'd like.
Go ahead. I think that more importantly is if as obviously you're in a school where very socially conscious, and this is the idea of when you're working with community is to be aware of the political climate, the historical trauma, the intergenerational trauma that is involved. I think that we do tend to, as psychotherapists, we do tend to obviously want to pathologize, and what is important is looking at things from a trauma informed lens, which is really, really important. That's really the only thing I can think of right now.
Thank you.
I would say that you can't fully understand your client's narrative and their life experience until you understand the political climate, the policies that are affecting them directly on a daily basis, things that may not affect us, that we may hear in NPR and be like, oh, that sucks, right? These are people's daily lives that they're being affected by. And understanding that our culture promotes institutional racism, and these people have to face that on a daily basis on a very personal level, in their housing and accessing food and accessing healthcare. And really, you guys are in a really unique position to advocate and to learn your community resources and say, like, hey, this is available to you. And to validate those feelings of, I understand this is really awful, and I understand that you're afraid to go to the food bank because you're afraid that someone might ask for your identification and detain you. And to have enough information in order to be able to comfort them and reassure them and validate them and to direct them where they need to go. Even, in therapy, understanding basic needs is really the first step before somebody can get better, right? And I would ask for you guys to leave today and continue to inform yourself about policy, about institutional racism, and how that's going to affect your clients, and to advocate for them. Advocate to the prescribers, advocate for the people doing the diagnostics if you can, because we're not all informed and we're not always correct, right? Some of us are careless people who just show up to get a paycheck, and that's awful. So make sure you are the advocates.
Thank you.
Thank you for that. I think the most important thing that I wanted people to walk away with is the idea that we can build our own infrastructure that's not trapped in this like either capitalist like model or big bureaucratic nonprofits that behave a lot like for-profits in a lot of ways. We all have to earn a paycheck. I work for the for-profit medical industrial complex to pay my mortgage. And then on my days off, I go to Patch, right? And we can build that. And to some extent, many of us will be trapped just for our paychecks, working in broken systems, but we can't let it end there. We have to continue to do the work of bringing together community and building infrastructure and supporting movements in ways that are bigger and more beautiful and more holistic and more historically and politically aware than what we often have space and time to do in the confines of our paying jobs. And so connect with movements, connect with people who've already been doing the work for a long time, especially connect with immigrant-led movements or movements affected by most affected communities, whether it be immigrants or LGBTQ or women or Muslims or any of the many groups that are under attack right now, and find ways to be able to use the skills we have to support movements being led by communities that are marginalized. So, thank you.
Thanks, Jason.
I know I talked about this already, but please make good progress notes. Push yourself. Put yourself in it. Do a little poetry. Feel out the room. Use quotes that the person is saying. You have no idea. You have no idea this stuff wins cases. If I can find enough things in a progress report and show actual progress, I can convince a judge to let my client out. It actually matters. And if I take these, progress notes that nobody is putting time and effort into and show it to the judge, I can't make a case because I'm not the one who met with the client, because I am not the expert in that, nor should I be. But yes, and then responsibility, and I don't think that you guys are the problem, I really don't, but you guys are, the movers and shakers. Nobody says that anymore, but you guys are that. Don't conduct an evaluation if you don't speak the language. Push people to understand that it's better not to do something than to do it poorly. And I think that it's very hard to come to a situation, I get that. I get saying, well, if I don't do this as well as I can, then no one's going to see this person. And maybe that's true, but whatever you do for them is going to have consequences, and you don't have all of the information. Learn Spanish. I don't know. If you're going to work with immigrant communities, and I don't say that in a passive-aggressive way, it's if you're not going to have the interpreters there, learn Spanish. It changes your clients' lives. I have seen the difference between clients who are approached by someone who is pretending to speak Spanish, someone who has an interpreter, and someone who speaks Spanish. It is completely different, and you will get different places, and you will have a different relationship with your clients. But mostly, what everyone can do is just write me some really good progress notes. That would be. Thank you, guys.
Awesome. Thank you so much, everyone. So, do we have the cordless mics ready for Q&A? We're good? Yay. Thank you, Michael. All right, so this is your time, y'all. Please, questions. Oh, here we go.
Thank you so much for being here. This is awesome. Really been craving this kind of conversation, and glad you're here. other than progress, what do you recommend our progress notes demonstrate?
If someone, don't make conclusions. I think that there's a lot of people trying to figure out, people going above and beyond in the other direction. I think there's a lot of politics in progress notes. And part of what I am asking you to do is to put some politics into progress notes, but a lot of what I'm seeing is, well, I met with the person, but then I also heard from someone else that he was doing fine in the rec yard. You know, that's a problem. That's no good. Or a ton of progress notes that all say, you know, reinforce for good behavior. I mean, all of this standard language that then, you know, a judge says, well, you know, this is generic. I see this in all of them. This is not, you know, if I try and point to something that looks positive and they say, well, you know, people just put this in. So then what am I working with? And I'm happy to give you a more complete answer. I'm going to think on it. But really just... We have case notes. We do case notes. I know what a bad case note looks like, and I know what a good case note looks like. And a good case note to me is a case note where you feel like you were there. And I know what the client was sort of feeling like, and I know what I was feeling like, and I know what we sort of ran into, and I know where things were good, and I know where things were bad. And I think that that's what progress notes should look like. And I just see a lot of elaboration on things that are detrimental to clients and not necessarily doing anything to further their mental health care. But thank you for asking. You're listening, and that's amazing. So excited.
Hi, that was amazing. Thank you so much. I just learned so much. I really appreciate all of this learning and the framing of like state violence, political violence, structural violence as traumatic and a mental health issue. One of my mentors defines racism as group differentiated vulnerability to premature death, and I think that this line of reasoning really fleshes that out in a whole new dimension. So I really appreciate that, and I wonder if you know, I know that I love the idea of just building alternative infrastructure like that on the ground immediately. I think that's brilliant. I also think the other side of that is looking at like the resources, where resources go. Like, you know, the biggest mental health facility in the United States is the Los Angeles County Jail, right? Which is also the biggest jail in the world. And there, you know, I've tried to help people find resources for mental illness in the city of Los Angeles, and there's just, it's very, very difficult. So I wonder what you see. Do you see a role for the idea of like mental health professionals speaking out in terms of funding priorities? I mean, so we want to like build alternative institutions that go outside the state at the same time that, you know, the state that we live in has these, you know, this incredible amount of spending on these traumatizing practices, and I wonder if you could, anybody can speak to that.
So, thank you, Zoe. That's a great question. And so, there is a long history of medical activists being involved in support of social justice movements, not just immigrant rights movements, but across the board. The history of medicine is complex, whether it be psychology or surgery, right? And it's sort of simultaneously and authentically a history of some of the best that humanity can be and some of the very ugliest and the most oppressive that humanity can be. And it's important to not erase either sides of that history because they're both equally real. You know, the history of medicine is a history of experimentation on slaves. It is a history of non-consenting, you know, sterilization of women in the South that didn't even know they were getting sterilized. It's the history of, and we see today just like a lot of that oppression. But it's also, there's a parallel history of doctors and nurses and counselors and psychologists being on the front lines alongside social justice movements. things. There's something called a white coat march, which is sort of ironic because when we're talking about clinical practice, we want to minimize, we want to try to undo. We want to try to undo some of our privilege. Yeah, I'll steal this one. Sorry about that. Oh,
no.
Check. We want to try to undo some of that privilege, right? We want to throw away the white coat. We'll put it in the closet. We want to sit down to eye level with our patients, try to create a more egalitarian thing. But in the political spectrum, sometimes that privilege can be a tool that we use to advocate for marginalized populations. Because how the state tries to dismiss social justice movements is by saying, oh, well, they're just a bunch of ignorant radicals. They don't understand how the world works. Well, we all know that the radicals are the smartest people. I'm the only ones asking the real questions, right? But sometimes getting that white coat back out of the closet and putting it on and showing up and saying, as a medical professional, this policy is reckless, dangerous, and stupid, and here's why. And here's that's not what the evidence shows. You're not going to, often the language of medicine is used as a tool of oppression, right? And we hear this. We hear, for example, politicians saying, oh, well, these immigrants come across the border and they don't have no vaccinations, they're bringing all kind of disease. There's no evidence for that, right? I'm here as a medical professional to say bullshit. And people need us to stand up and say that. And as counselors, there's a lot of space for us to support immigrant-led communities. And I think I should pass off to Fabiola for that, because she's the one who's, I think, most directly intersecting with these movements. But that's it.
Yeah, I think, that's such a important question, because I feel like we're right now kind of across the country learning as we go, experimenting, but really for the love of our communities. I'm part of a collective in Tucson, and we do Healing Justice Days. So we open up a day for alternative medicine, for free community acupuncture, somatic experiencing, massage. So that is part of the issue here, is that we're doing this for free, right? And that's not a problem, right? This is why we're doing this. But also, some of us want to be part of, I work in, my daytime job is in the behavioral health system in Arizona, and as fucked up as it is, we also, those of us with this framework and anti-oppressive framework, we want to be in those systems as well, so that we're also advocating for the folks who are, the poor folks, those who without access to resources that are coming in. I don't know how many times, I could get very dirty while I'm advocating and I'm fighting for some of my clients, because one time we get this new psychiatric nurse, and she right out of school, and she's just diagnosing people left and right with bipolar. And I'm thinking, wait a minute, all of a sudden I have this pattern, all my clients have bipolar, and so I have to advocate for them. And I go directly to her, and I said, what's going on? Can you tell me what the process that you're using? And she's working off of this screening tool. I'm like, really? That you don't use just one screening tool to diagnose? It turned out that she had other confrontations with other staff. She really was not meant to be in this field. She had some personal work to do herself. But that's just an example of how I maneuver my way in, is really advocating for my folks within that system. But on the outside is being on the front lines. Being that one who will step up when someone needs a phone call, to talk to me, at midnight. But really being able to stream that out, that it, so that it's a collective process, so that it's not just because we're talking about folks who have these practices, healing and traditional practices, that have been lost. right? And so it's about helping them regain them, and that healing comes naturally, but with the support of the community. And so, yeah, absolutely. Everyone needs, personal work. They need one-on-one therapy, but also collectively, I think that it's very necessary, and that's how movements rise. I was thinking of you were talking about the medical industrial complex and how they've experimented on folks, but there's Harriet Tubman. She was a freedom fighter. She was a nurse, and that's this is how we have history, right? There's a history there that our helping professions, our healing professions, can heal together as community.
Yeah, Valentina?
I'll do a quick one. It'll take like 2 seconds. Disrupt the existing, I don't know the red tape behind this. I'm a lawyer coming to this, from a very, very different world. Small studies, however small, they help us. We need to educate judges. We need to educate other people. I don't know what your capacity is to do these things, but if you find yourself in a community where you think that the pattern or practice that you're seeing would be helpful for other people to see, figure out how to record it, because people can use it. And we're using stuff from all over the place, and everybody, does what they can with it. I don't know. Go rogue. I don't know if you guys can just say, hey, we're going to do this clinic where we go to the detention center. When people show up who aren't supposed to be there, everyone suddenly starts acting differently, and that's a way that you can change people's behavior. And you can be dealing with a totally different population. I think that there's a lot of educational value there, but I think that it would also change how people act.
Thank you. Any questions?
Sorry.
I just got so excited when you said, helping people rediscover their own healing and traditional practices. I'd love to hear more about that. It's one tension I've been sitting with this whole time is, yes, there are some things about our work as psychotherapists that is profoundly healing, but the mainstream schools of psychotherapy were dominated by white men. And so I'd love to hear your thoughts about that.
Yeah, if you think about the idea of limpias, right? Spiritual cleanses that in Native and indigenous communities, and I know, and definitely in Mexico, that those were practices that were every family knew about. You have to go get a limpia, right? And people are like, eventually it got stigmatized because of the colonial system that we live in. And so now in these healing justice days, we encourage that. We encourage, yes, we have someone who is a healer who can come and do a limpia, a medicine person. So the other thing is storytelling, for example. That is ancient, right? Oral tradition, and encouraging that in talking circles. That there is no one expert, right? I am not the expert in the room. You all are, and let's talk about who has these stories to tell. Whether it's about creator and whether it's about maybe your family, it doesn't matter. Storytelling's another, ancient tradition. Yoga, it's been, repackaged and very, yoga really is another ancient healing tradition. Acupuncture as well. So some examples. Mm-hmm.
Other questions?
We hear you.
Well, it's for the live stream, actually.
Sorry.
I'm not exactly sure how to ask this, but I'm wondering, I heard a couple of you talking about the SMI designation, and I'm wondering how we balance seeking that SMI status for our clients that are immigrants, knowing that some of the benefits it brings, but also some of the unintended consequences that it would have, and some of the social stigmatization that we have with that.
Yeah. Well, I'm the one that mentioned that, and I think that, you're absolutely right. If I can, I try not to, right? In fact, it's the case managers who do that evaluation. But that was something that came up for one of our clients in our clinic because of the diagnosis that he had with schizophrenia, actually from when he was in Mexico, and then when that was the reason, he was in Mexico, he was diagnosed with schizophrenia, then he came to the U.S., and he didn't have access to the medications. So we determined, okay, how about an SMI determination, because that's where, you could get these services that you would normally get for free.
We love the SMI designation because it gets our clients benefits, but we do run into a lot of problems with stigma, and I actually completely forgot what I was going to say, but it did have to do with the SMI designation, and I'm sorry, guys.
Any other questions? Oh, yeah, go, Valentina, please.
Sorry, it's when it happens, it happens. Go ahead. We have another ethical dilemma. We have options sometimes. And so one of the things, this is another client happening right now, administrative closure, I'll make it quick because it's legal wonkiness, but there's political asylum, which is good times, and you get services. And then there's administrative closure. And you have, ostensibly a better shot at it than asylum, which is such a high bar, but you don't get anything if you get administrative closure. So I'm really just bringing that up as another fork in the road, another point where you say, okay, how much do I want to bargain and for what? And where release is really hard, because what is a win? If someone gets administrative closures, the same thing with the bond. If my client gets out, it's pretty stressful. It's pretty worrisome. You don't know where they are, and you might not hear from them, and we have a lot of services. We get people's cell phones. We're very, very fortunate to be able to do this stuff, to be able to set up an infrastructure where we can keep in touch with our clients and get them medical and mental health care, but, we kind of know what we're bargaining for at every point in the road. So that's just another.
I just want to say, I think, like on any journey, we want to be able to keep our eyes on the horizon and understand what the goal is, and we also want to be able to look down where our feet are and not trip over that rock, right? And so we have to be able to think short-term strategy and big picture at the same time. And so we don't want to fall in the trap of becoming so idealized that we can't make concessions for short-term strategy, and we don't want to become so accepting of, but here's how this administrative situation works, and forget that okay, yeah, but the system sucks and it doesn't have to be that way, and we can dream something better. And so in this context, the for-profit prison industrial complex is evil. I don't think we should be afraid to use that word, right? But we're trapped with the system, so it's not a contradiction to say, okay, well, it looks like while they're in detention, if it helps their case, maybe it's good to have the SMI diagnosis. When they get so they can get out. As soon as they're out, get them to Maria, and maybe she's going to keep them on the meds, and maybe she's going to be you don't need that shit, right? But it's not as simple. We don't have to oversimplify it and say, well, do we want more people diagnosed as SMI or less? We can say what's strategic in this moment to fight for our patients? Mm-hmm. And the answer to that is going to depend on the type of oppression and the type of structure that patient is trapped in at that moment.
Any other questions?
You guys have been amazing.
Before we wrap up, I promised the online social justice and community organizing program that I would let the counseling department know that the current cohort online is prepping for a campaign to gather signatures, digital signatures from the counseling students for the Freedom Education Fund to expand. Right now, the Freedom Education Fund is on campus; it's residential. So their efforts are going into expanding it into the online program. So definitely be on the lookout for that, and please sign your signature on that when you get the email. Oh, we have another question. No. Could you get the microphone?
Well, I just think this experience has been really powerful, and I'm curious to know, like, what it would be like to kind of take this panel in other settings. And I'm curious if that is at all feasible, because I think a lot of people would really benefit.
My heart. I mean, I'll just say briefly if you guys want to talk about it too, but in terms of Prescott College, after my workshop today, there was a lot of talk about how we can have more departments collaborating with each other, and obviously this has been really great. SJCO collaborating with the counseling department, and so that's a way that we could definitely bring in more panels similar to this, or them again. I'm down with that, and that's kind of something that I would like to focus on for me.
I will come whenever.
Done.
I mean, even offering the students to come in and check out the different sites where people are doing this work. I invite folks in Tucson to come down, and that'd be really awesome.
And likewise, Clinic Apache in Phoenix, check us out online, come visit us.
We need therapists. We need counselors.
We do.
This video is going to be online, so I should say that the Florence Project needs volunteers and donations always.
So I have a question. What kind of standards or what requirements do you have for the people that come and do volunteer work? Is there, because obviously you probably have to make sure that you have individuals that don't come in that have an agenda with immigrant populations and to try to take advantage of them, because there are people in the fields that do that. They tend to want to find ways to hurt people. So do you have a screening process, or do you have application processes, and what kind of requirements do you have?
We do have a screening process, and so I don't know if everyone's interested in that question. If you want me to catch you afterwards, should I? I don't know how our time is.
We have about 3 minutes.
That's an excellent question. I'll just say briefly, we do have a system that we are trying to always modify and perfect to try to figure out who's coming for the right reasons and with the right intentions. If you want to learn more about that, let's catch one-on-one, and I'll talk about that ongoing